بس جو أربعة أشهر أخوي وأربع أخواتي لنا شوي
Thank you very much, Your Eminence, for joining us.
कहना चाहूँगा डॉक्टर क्रिस डिसूजा मेरे ईएनटी सर्जन है और लीलावती हॉस्पिटल से बड़ा लगाव है हमें, वहाँ पे बड़ा प्यार है। यहाँ के सारे स्टाफ, सारे डॉक्टर्स की हम बड़ी इज्जत करते हैं और हमारी जब भी कोई मुश्किल आती है तो पूरा विश्वास रहता है कि वो हमारी मुश्किल ज़रूर दूर कर देंगे। वर्ल्ड हियरिंग डे पे डॉक्टर क्रिस डिसूजा जो हमारी फैमिली के ईएनटी डॉक्टर है, उन्होंने मुझे रिक्वेस्ट किया आज यहाँ आने के लिए और इट इज़ माय ऑनर दैट आई कुड बी ऑफ एनी हेल्प and of any use, and so I'm here and I wish all the people with facing hearing challenges the very best and excellent advances made in technology which will help them live life as normally as possible. So I'm glad about that. Thank you very much. Thank you.
These patients, watch their progress, deal with problems, and then see them. Now, we have many success stories. Child comes to mind, and she was the daughter of the servant of one of our doctors. So we implanted her. She got her hearing back, and I remember the moment we stitched it on, she wept tears of joy because she said, I can hear for the first time, and I can hear music. And there were 5 donors in the room who they each contributed money to it. They were moved, and all of them wept with joy. Once this child got her hearing back, she finished her schooling. She got a college job, and lo and behold, she got a job for TCS. Here we have a very special portrait of the Lilavati hospital team. The implantable hearing about the ENT team, we are also seeing them. That's me. And this is the child following the surgery. A brilliant smile, absolutely, that's behind there. Now, where do we go after this? Do we? रो रही थी, मम्मी ने प्यार किया, हंस रही थी.
Thank you for all of you for being here on this World Hearing Day. Let me just briefly introduce myself. I'm the permanent trustee and some of the founder trustees that have set up this Lilavati hospital in the year 1997, which happens to be my late father, Mr. Kishore Mehta, and my mother, Mrs. Charu Mehta. This is a multi-speciality 300-bed hospital, which is focused in all kinds of spheres, and we deal in all medical treatments, including cardiac transplants, robotic surgeries, organ transplants, and many more. Lately, we have tied up with Mayo Clinic for all various medical services. We are coming up with a state-of-the-art hospital in Gift City, Gujarat, which shall commence its operations in the next 6 months. We have also announced a cancer hospital next door in the heart of Mumbai, which shall also be operational in the next 2 years and shall deal with all complex services and edge technologies, cutting services for cancer treatment. We have off late also announced our latest hospital coming up, a 250-bed hospital with the state government of Assam, and which shall be operational also very soon. As of today, being a World Hearing Day, we have completed more than 500 cochlear transplants for children, implants, I'm sorry, for children under the age of 2. This is a cutting edge technology which has changed the lives and enhanced the lives of these children and contributed more so to the Indian economy. I shall now hand over the mic to Dr. Chris D'Souza to enlighten you further.
Namaskar, I am Dr. Christopher D'Souza, ENT surgeon at the Lilavati Hospital. I'd like to express my sincere and grateful thanks to the Lilavati Hospital, to the trustees of the Lilavati Hospital, like Mr. Prashant Mehta, Mrs. Charu Ben Mehta, who is a trustee for life, Mr. Rajesh Mehta, and Mr. Rajiv Mehta, who are also permanent trustees. Through their help, encouragement, and cooperation, we were able to do these surgeries for these children. These children, as it's a social service to society at large, the trustees have very generously and graciously allowed these surgeries to happen and have contributed, therefore, to the growth of the nation. These children who are born deaf have been implanted by the age of 2 years. This allows them to hear clearly. Once they are able to hear clearly, they are able to acquire speech and language. This, in turn, allows them to enter schools that are teaching children with normal hearing. So we have found that once they have been implanted with both ears at the same time, they develop like normal children. This allows them to get a complete education and move on and get a college education. With a good college education and a good degree, they're able to get a good job. This, in turn, helps them to lift themselves and their family out of poverty and contribute meaningfully to our nation. So we are very lucky that to be working at the Lilavati Hospital, who gives us this opportunity to serve the disenfranchised society at large. Thank you very much.
Doctor, what is the difference between cochlear implant and traditional hearing aid? And who is the right candidate for the cochlear implant?
Thank you for that question. The question is, what is the difference between a hearing aid and a cochlear implant? A hearing aid requires the person to have some level of hearing. A cochlear implant is done in a person with no hearing. A cochlear implant, when done at the age of 2 in a child, this allows them to hear clearly. The center in the brain directs all the signals which in the brain for processing. This allows them to hear normally. When done in both ears, they are able to develop scholastically and psychosocially like normal children. So they're able to get 50,000 words and so on, speak like normal children. So this is a major advancement. Also, the device is getting more and more sophisticated and evolved. So this allows better features like the Wi-Fi, Bluetooth, live stream. All that is what they can achieve. Also, the device remains inside their bodies for the rest of their lives. The device is MRI compatible. And if they go through the airport for security, all that they have to do is show them the device, the card, and they will not be stopped. They'll be allowed to pass through. The device will remain inside their body for the rest of their lives and function absolutely normally. Of course, like all things, the external part of the cochlear implant needs to be taken care, needs to be looked after carefully. But we have found we have children who are had the device for 20 years. They are doing very well with the same device.
Yeah, you guys have to say about this very important day for getting. Yeah.
No, it's a very good event. Thank you, Jean sir, madam, and of course doctor for hosting this, for handling this event. It's a very good event, and I mean this is the first we just started, and as Mr. Mehta said, we are on an expansion basis. We are coming up with many other hospitals. Not even Mumbai will be start catering the globally as well, and some, of course the international patients as well. And I'll be very delightful to get more patients. We are happy to host them. As our tagline says, more than healthcare, human care. That's our main motive. And thank you all the dignitaries who have attended this event. Thank you.
Your final words, sir.
Yeah, hi. I'm Saurav Sharma, again one of the trustees here. So, as my colleague has already mentioned, and it has been said, but then again, I would like to reiterate on that part that we are coming up in Gandhinagar as well, and also we are planning to do a similar kind of camp over there as well in Ahmedabad. So, we are talking to Dr. D'Souza on this, and we are going to have a roadmap how we can take it forward from here. And there will be not only one, multiple camps will be held, and not only hearing, but also more of the cataract surgeries on eyes and all. You'll see a lot more coming. Thank you.
Thank you. Thank you.
Thank you. Thank you.